Okay, so good evening all. And today's session is on the CMS 1500 form, and which is used for the physician billing, as we already discussed in previous session. It is having total 33 boxes, and it is also known as HICPA. A long form is Healthcare Finance Administration, and CMS long form is Center for Medicare and Medicaid Services. Okay, so there are some important boxes in these 33 boxes. We don't have to worry about the UB04 at this point, which is used for the hospital billing. So we'll focus on CMS 1500 form, and always it look like this in reddish color, and there are total three portion. One is for the carrier, one second portion is for the patient and insured information, and third portion is for the physician or supplier information. Okay, so one by one we'll try to understand this claim form, and every single claim form is the unique claim form because there is a barcode, so we cannot use the same claim form for multiple patient. Okay, and even though we are sending electronic claim form or the paper claim form, every claim is the unique claim form, and there are charges. It is not free of cost. If you are talking about the electronic claim form, the charges are $4 to $5 each claim form, and if you are talking about the paper claim form, so it will cost up to $18 to $20, and additional cost will be there for the sending paper claim form, that is the courier charges. Okay, so almost $40 to $60 will be there for the courier, so almost $80 we have to spend to send our claim form. Instead of that, fastest way is the electronic claim form, and the costing is also less. Okay, so that's the reason everybody is preferring to use the electronic claim form. Okay, so first portion on the claim form is the carrier. So carrier is known, name is insurance. Insurance is nothing but the carrier. Okay, also known as payer. So if somebody is using word as a payer or carrier, it is nothing but the insurance. So first portion is for the insurance information. Okay, so here I have added some BCBS and address and all, but manually anywhere we are not doing this kind of changes. Okay, just for understanding we are doing this, but in live when we are starting work anywhere, so anything if you want to add or update on the claim form, that needs to be done in the application itself and build the claim, and it will reflect on the claim form. Okay, so this is designed and created by American Medical Association, and it has been approved by National Uniform Claim Committee. Don't worry, nobody will ask you this thing. So second portion is for the patient and insured information. So insured means policy holder. Okay, and patient might be policy holder or maybe the family member who has added into the policy as a beneficiary. So left portion is for the patient information, right portion is for the insured information. So box number one, so there are total 33 boxes, and you don't have to mug up or remember all 33 boxes. I'll tell you 10 to 12 boxes needs to be remembered, and in every interview they will ask you one question on the claim form, and they will ask you random boxes, and we should not miss that easy question. Okay, so you can remember only 10 to 12 boxes, and you can easily answer for that. Okay, so first box number one is having some insurance names. You can see Medicare, Medicaid, Tricare, Shampoo, all over US, in every state for any specialty needs to be used this claim form only. Insurance cannot design their own claim form. Okay, so this is the common claim form everybody have to use for the physician charges. Okay, so you can see some insurance names are there. Obviously it is designed by US government department, so these names are for the US government insurances. The government they are providing some insurances, and there is eligibility criteria accordingly the people are getting insurance from the government. And at last there is a box of other. So first is Medicare, Medicaid, Tricare, Champa, Group Health Plan, FECA Black Lung. These six insurances are provided by US government, but there are some eligibility, and we'll discuss that later. And at last there is a box of other. So any other insurance, if you are billing claim, then other checkbox will get checked. Okay. Box number 2 is having patient name. So there is a format in all over US, name format will be different. Okay, let me check. Okay, I'll create one document. And insurance is also called as carrier, is also called as payer. And doctor or hospital is also have one common name, that is the provider. Okay, so if someone is using, or I am also using the word as a provider, that means doctor or the hospital, whoever is providing health related service, a common name for that is called as provider. So might be the compounder, might be nurse, might be the doctor, hospital, pathology, or ambulance, anything. Okay, so provider is the common name, who is whoever is providing health related service. So we were talking about the name format. So all over US, name format is different, not like the India. How we are having first name, middle name, and the last name. We are following that, right? But in US, the format is last name, first name, and middle initial. So it's the last name, first name, and then middle initial. That means if I'm writing Smith William J. So here Smith is the last name, William is the first name, and J is the middle initial name. So how it look like on the claim form or the ID card? We have to um, say like that only. If you are talking to the representative at insurance and if they ask you the patient name, you should not say William Smith, or else they will open the wrong claim or wrong patient. Okay, so instead of that, just open the claim form, and how it is looking into the claim form or in the application or on the ID card, everywhere the format is like this only. Okay. Okay, so this is the format everywhere. Any in all over US, they are following this format for the name. Box number 3 is for the patient date of birth. Now date format is also different in US. Date, so we are following DDMM uh, and then YY, but they are following MMDD and then YY. You can see here MM. I'm writing 7 and then DD and then YY. So example, if you are telling them the date of service or date of birth, anything, if a representative asks you, tell me the date of birth, and wrongly if you are telling them 7th February, because we are using the format DDMM from long time. Okay, so this mistake I also did initial days. So you have to remember, this is the month and this is the date. So if you are telling them 7th February, they will not be able to find, or the data is not matching with their system. Okay, so this is the 2nd July 2024, and we should not say 7. Means many times I saw freshers who are joining in the company, they are if any date of service they want to say, then what they are telling, 7 uh, 5 2024. But instead of that, if we are telling them 5th July 2024, that is the accurate Okay, so always we should to we are using this format. Okay, DDYY. Initial days, some days you will struggle with these small things, but after some days you will be used to this format and the name format and all. Okay, and then gender, male or female, and box number 5 is for the patient address. Sometimes patient and the insured or the policyholder address can be changed. Okay, so whatever address will be there, they have to enter, it will go here. Okay, and these all the data is not entered by single person. As we discuss in RCM cycle, every department is entering the respective data according to their roles and responsibility into the same software. Okay, eligibility and benefits team, they are entering their information, and patient appointment, they are entering the demographic details mostly. Coding team, they are entering the codes. Charge entry team are entering the charges. Okay, so everybody is entering the information into the same application, and when we are billing the claim, all those information is going on the single claim form, right, on this page. So patient address will come up here. Then box number 6 is the patient relationship to the insured. So might be possible the patient and the policyholder is the same, or spouse. Spouse means if the policyholder is husband and the patient is wife, and vice versa. So single word is used as a spouse. Children or sister, father, mother. Okay, any other family member is for the other. So whatever important boxes, I'll let you know which you have to remember. Okay, so don't worry. Box number 8 is reserved for this National Uniform Claim Committee, so we don't have to worry about that. Box number 9 is for other insured name. So whoever is other members on the policy, okay, that information is going here, but mostly I never saw this. And we can ignore this box. Okay, box number 10 is for the is patient condition related to. So due to what condition patient came to our hospital, that needs to be go here. So example, if anything happened with the patient due to his employment or on his workplace, any injury, or he got sick in office itself, so that time yes will be checked in front of employment. If any accident due to the bike or car auto related accident, then it will check here. If any other thing, then it will check in box number C under the other accident. Okay, or else it will go like this, no, no, and okay. So example, patient is having one insurance which is given by the employer, and the injury is happen at his workplace. So that time we have to select the worker compensation insurance that is given by the employer, and the checkbox will check under the 10 box number 10 is under the employment. So claim codes, ignore this. Box number 1A. Now we are talking about the insured information. Left side patient information. And important box here is the box number 1. That is for the insurance name. Okay. And later remaining things is important box is the 10. Box number 10. Okay. Then box number 1A is the policy holder. Whatever is policy ID is given on the ID card, it will go in this box number. Insured name may be same or different, so we'll select as the same. Insured address in box number 7. Box number 11, insured policy group or FECA number. Okay, so whenever we are checking the insurance ID card, you, let's see insurance ID card example. Okay, sometimes some policies are the group plan, so that time group number will be given on the ID card. You can see here, group number is there, right? So this is the policy ID. Member ID means policy ID, and group number is this is the group policy. That's the reason there is a group number. Otherwise, it is not mandatory. Okay. So that group number will go here if it is a group plan. Okay, or else it will go as a blank. Box number 11A, insured date of birth. Okay, same format, MMDDYY, and then gender, other claim ID, ignore it. Is there another health beneficiary plan if patient is having one more or two more insurances? Then yes or no. An insured or authorized person signature. Actually, we cannot sign anything by pen on the paper. All these are digital signature only. Okay. Even though we are sending paper claim form, we should not use any pen to check anything or to sign anywhere. Okay, or else that claim will not be accepted by the insurance. Okay, so this is the digital signature only. This is for the patient and this is for the policy holder. Okay. Now, till now, we saw about uh, the patient and insured information and the carrier information. And from this, you just have to remember only three, four boxes. That is the box number one, box number 1A, box number 10. Okay, these three boxes you have to remember. More boxes you have to remember from the this portion, that is the physician or supplier information. That means the provider information. So box number 14, it is for the date of current illness or injury. That means from which date patient is got injured or ill. Many times we know that uh, we you can take your example itself. If you are feeling sick, that day itself we are not going to any doctor if it is not serious. Okay, we are not going to the specialist or the hospital. Okay, 1 or 2 days maybe. If it is not serious, we will wait. Okay, and later we'll go to our family doctor. We are not directly going to the hospital if it is not the serious thing. And family doctor already given a prescribe, and after that also 1 week, after 1 week also we are our condition is not well and it is same only, or maybe it is getting bad. So that time our family doctor will suggest us any particular specialist or the hospital, and we'll go there. So consider that one patient came to our hospital to take a service, but he got injured 1 week or 2 week back, and today he come to our hospital. So from which date he got injured or illness, that date we have to enter here. Okay, or maybe the pregnancy date. Whatever this box is for the three things. One is for the date of current illness, injury, or pregnancy. So one of the date will go here. Okay, this is the important and required box. Box number 15 is for the other date. I never used it anywhere in my career, so you can ignore it. Box number 17 is for the name of referring provider or other source. So you have to remember this box number 17 because mostly interviewer will ask about this. So as I said, provider means what? Doctor, right? So we are talking about box number 17. Box number 17 and 17. So it is for the referring. So referring provider means what? The doctor who referred patient to visit our hospital. Okay, so consider that patient went to his family doctor, and family doctor has suggested to come to our hospital and take the further services. So that family doctor is called as PCP, primary care physician. It is PCP, also called, we can remember as a family doctor, who used to provide a basic services, who is not specialist, who is a degree holder. Okay, so referring provider means, most of the times referring provider means the family doctor who is the primary care physician for that patient, and we have to enter his name here in box number 17. Okay, and second thing is the NPI we have to enter. So what is meant by NPI? NPI. Okay, don't worry guys, all these things will be there in our notes. Okay, so national wider, it's a 10 digit number, and every provider will get that. So provider, as I said, provider means doctor, hospital, any facility where patient is getting health related service. Pathologist, you know that, physiotherapist actually is not the doctor, but he is also getting NPI because he is providing health related service. Okay, so this is the 10 digit number. So we have to enter these two details about the referring provider, that is his name and his NPI, in box number 17 and 17A. Okay, so consider that, Debbie, whatever name. Now box number 18 is hospitalization date, from which date he is in our hospital. Okay, so that date, March 15th to current date, March 22. This is the box number 18. Box number 16 is for the date patient unable to work in current occupation due to the illness or injury, from how many days or the month he is not able to work, that those dates needs to be entered into the application and it will go in this box. Okay, so maybe from February 10, 2025 he is not able to work, and current date is 3/2020. Okay. So this is about the date patient unable to work and hospitalization date. Now we know that all these 33 boxes are dedicated to some information. Okay, we cannot use this box for any other purpose. So that's the reason we got one more additional box which we can use for any purpose. So that is the box number 19. It is the additional claim information. So for example, we are sending medical records with the claim form. So where I can mention that? I can mention in box number 19 as attach medical records with this claim. I can use this box for any purpose. Okay. Consider that patient has recently updated some information at insurance, whatever required. Okay. So recently patient has updated COV information. So process. Okay. Anything. We can use this box as a additional information. Box number 20 is for the outside lab. So lab means what? Pathology or the radiology lab. Many times we know that if you are going to hospital and doctor ask you to take some blood reports, then only he can decide what kind of prescription needs to be given. So if pathology is available in the hospital, that is good and well. We'll give our blood sample and we'll take a service from the same hospital. But in case the pathology is not there in the hospital, what we'll do? We'll go outside. Okay, any pathology, we'll take those reports and we'll come back, and then doctor will read the reports. Okay, so if patient is going outside for pathology or radiology, and he is spending some money outside, maybe from his pocket or maybe his insurance is covering those services. So that pathology will send a claim form, whatever services he has taken. Okay, so if patient went outside, then it will go as a yes, and whatever bill was there for him, that will go here. Okay, we are not sending, we are not billing this. Okay, we are just mentioning whether he went to outside or not. Okay, if it is not, that's fine, we can ignore this, it will go as a zero then. Or if he has taken inside only, then also amount will go, but it is not outside, it is inside only. Box number 21 is for the diagnosis code. So what is meant by diagnosis code, and all the things will be covered in our coding session, so don't worry guys. Okay, so diagnosis means nothing but whenever patient is going to the doctor, first of all doctor have to check the patient, what happened to the patient, right? So that part is called as diagnose the patient. First of all, he will diagnose the patient and decide that what service needs to be provided. So every service, that is called as procedure code. For example, this is the normal general checkup procedure code called as evaluation and management procedure code. So every procedure code should have the related diagnosis code. Okay. So example, this look like, okay. So it is going, yeah, all this part is entered by our coding team. We don't have to worry, and we don't have to remember anything from the coding. Okay. In coding sessions, I'll let you know what needs to be remembered. Okay. So these diagnosis codes are here. Might be possible here some codes are there on the claim, and related diagnosis code are entered in box number 21. So how the insurance can understand for which procedure code, which diagnosis code is entered. So there is a box here as a diagnosis pointer. Okay, so these diagnosis pointers are A, B, C, D up to L is there, right? So these are the pointers. You can see here B. So B means for this procedure code, this is the diagnosis code. Might be possible that this procedure code is having two diagnoses. There is no sequence. Okay. So B and A, that means these two diagnosis code are related to this procedure code. For this, maybe it is A only. Like this up to L. If required, then diagnosis code will be there and related pointers will be entered in front of procedure code. Okay. So we'll discuss later again in the coding sessions in detail about the procedure code, diagnosis code, modifier, everything related to the coding. Box number, you just remember box number 21 is for the diagnosis code. By box number 22. So box number 22 is for the resubmission code. So if we are submitting our claim form first time to insurance, so that claim is called as fresh claim. Okay, if we are sending our claim form first time to insurance, then that claim is considered as a fresh claim. So it will go with 01 code here. There is no original reference code. It is called as claim number only. So it will go with 01. Okay, and if we already sent our claim to insurance and we did receive some denial, okay, example we can take as a coding related denial. So what we'll do as a AR, we'll forward our claim to the coding team, we'll receive some response, and accordingly we have to update in our software, and we'll rebuild the claim. So that time we have to rebuild as a corrected claim. So when we are selecting as a corrected claim, the code will go as a 07, and also the claim number whatever was denied EOB was there, so that claim number will go here. So insurance can understand, okay, this is not the fresh claim, this is the corrected claim. In case we did a correction but we missed to mention as a corrected claim and we billed with 01 only, so in that case what will happen, insurance is already having one claim with 01, right? So again we are billing with 01, so they will deny this claim as a duplicate. So this is very sensitive. If we are sending corrected claim, it needs to go with 07 only. Okay. So that is the resubmission code for the corrected claim form. Okay. And for some insurances, it will go with 01 only for Medicare, Medicaid. Okay, we'll discuss again on this. They are the government insurance, and we don't have to mention with 01 in our system itself, setting like that in our software. So if you are billing any corrected claim to these insurances, it will go with 01 only. They are exception. But for all other insurances, if you are submitting corrected claim form, the code for the resubmission code will go as a 07, and the claim number on the denied EOB that will go here in this box, in box number 22. Now box number 23 is for the prior authorization number. So it is not mandatory. For some procedure code it is required. So authorization means nothing but the taking permission from the insurance company, and whatever permission number or the authorization number we have taken for providing that service will go here. Okay. Again we have a detailed discussion on it. Okay. So this is about the 23, and this is also important box number. Now box number 24 is starting from here and it is ending up to here. So box number 24A to 24J. Okay. So box number 24A is having the date of service. Again it is the MM, DD and then YY. 20. Okay. So same here. MM, Box number 24B is the place of service where actually service has been provided to the patient. Okay, lot of place of services are there. We'll discuss later. Example place of service is the emergency department. Okay, so such kind of place of services will come up here. Box number 24C is for the emergency. I never use it. You can ignore it. Box number 24D is for the procedure code, also called as CPT code. Okay, so these are the actual services what we have provided. Okay, and our coding team, whenever they are entering these codes, they are following the medical records, and in medical records so many pages are there, but one as a part of medical record, super bill is there. So mostly required information for the coding team is available on the super bill. On the basis of that only they are entering the code into the software. Okay, so box number 24D is for the procedure code, and it is a 5 digit, sometime numeric, sometime alphanumeric. Okay, and box number 24D itself, there is a four more boxes for the modifier. It is not mandatory. Okay, like how the diagnosis code are mandatory, but these modifier are not mandatory for procedure code. They are additional information for the procedure code. So example, this is the X-ray code. So if we have taken X-ray for hand, but which hand, left hand, right hand, so that additional information we can send it as a part as a modifier. Okay, so this is not required information, it's additional information. Box number 24 is the diagnosis code, and actual diagnosis code are available here. Box number 24F is for the charges. So how much we have billed for this procedure code, for this procedure code, that charges are entered by the charge entity, right? And the box number 24G is for the number of units or days. So for example, this procedure code is provided only once. This is the X-ray and we have taken twice. Okay, like this. So number of units will go here. Box number 24H is for the family plan, and it is reserved for the family plan. So I never used it. You can also ignore. Okay. So box number 24J is for the rendering provider. So previously we saw about the referring provider. Referring provider means whoever referring that patient to come to our hospital service. Next is the rendering provider. Rendering provider means the doctor who is actually performing the service. That doctor is called as rendering provider, who is rendering the service. His NPI will go here. It is also 10 digit. Okay. So box number 24J is for the rendering provider NPI number. Box number 25 is for the tax ID number. How we are having PAN card number in the India for taxation purpose. They are having tax ID number. Simple. Okay, it is also having social security number and EIN number, but mostly what is meant by SSN and EIN in terminologies will cover again. 24, just remember 25 is for the federal tax ID number. So example, you are working for a single doctor, your client is only single doctor, so his individual tax ID number will go. But if you are talking working for the hospital, so all the claims payment will come to the hospital account only. So this tax ID number is also for the hospital, not for the individual doctor. Okay, box number 26 is for the patient account number. So as I said, every time if patient is coming again and again, we are not going to create a new account every time for that patient. There is a single account for every patient in our software, right? So that account number will go here, so that whenever we are receiving any document, any EOB from the insurance, and that needs to be posted into the patient account. So on the basis of this account number, uh, directly into the correct account, payment posting team can post. And this account number, our every insurance company also they are mentioning on the EOB. So this is very important. Okay, if you are missing this and we are receiving the EOB and with the same name we are having three patients, how we can identify in which patient we have to enter the information? So that's the reason account number box is there. Box number 27 is for the accept assignment, like terms and condition. Always go as a yes. And box number 28, the total charges. Example here $700 and amount paid. If patient has paid or if primary insurance has paid anything, so that amount will go here, or else it will go as a blank. Box number 30 is reserved for the NUCC, so we don't have to worry about that. Box number 31 is again for the signature of the physician. Again, this is a digital signature, not manual signature, and this is the date on which date it has been signed. And 32 box and 33 box, so we should not get confused between 32 and 33. Many times interviewer can ask you and we are giving wrong answer. Okay, so remember that box number 32 is for the service location information. Where the service has been provided, that address will go here. So example, our hospital is having 5 branches in the city. So in which branch, on which location, on which address service has been provided, that address needs to be go in box number 32. And 33 is for the billing address. So billing address means all the checks, all the EOBs will go to a particular address. If 5 branches are there, maybe only one branch is the head branch and they have created a billing address there, and all the insurances will send all the EOBs and the checks and the letters documents on the same address. So both the address can be different or can be same, depend. If the hospital is having multiple addresses for service and billing, then addresses will be different. Okay, so while denial again we'll discuss. Okay, we have to make sure that all the EOBs should receive on the billing address itself. If any address is not matching with our claim form, then we have to request them to stop the payment or the sending EOB. We'll discuss. Okay, so at this point just remember box number 32 is for the service facility address and 33 is for the billing facility address. Okay, and again there is a NPI. Okay, so box number 32A is again the hospital will get a separate NPI 10 digit, and the billing address also will get a NPI. Okay, this information will go, and from these boxes, which boxes you have to remember? You don't have to remember all 33 boxes. Okay, so it is in our notes which boxes you have to remember. So these are some boxes. I'll recall it. One is for the insurance names. Okay, Medicare, Medicaid, total 6 7 names are there, we saw. Box number 1 is 1A is for the policy ID, also called as subscriber ID, also called as insured ID. Box number 17 is for the referring provider name. Box number 17B is for the referring provider NPI. Box number 19 is for the additional information. 21 is for the diagnosis code. 22 is for the resubmission code. So 01 is for the fresh claim. 07 is for the corrected claim. Box number 22A is for the original claim number. Okay. So if you are submitting corrected claim, in that case only original claim number will go. Okay. Not for the fresh claim. And box number 23 is for the authorization number. If we have taken authorization number, it will go here. Box number 24J is for the rendering provider NPI. Box number 25 is for the tax ID number, and it is a 9-digit number. Okay, NPI is the 10-digit number. Box number 32 and 33 is for the service facility address and the billing facility address. Okay, so these are some boxes: 1, 2, 3, 4, 5, 6, 7, total 13 boxes out of 33 boxes you have to remember, and easily you can answer, and within a millisecond you should answer. You should not think, if somebody is asking you, tell me about the box number 17 and again 24J and 21, randomly he is switching here and there, so you should be able to answer quickly, because they want to know that whether you are having good knowledge about the CMS 1500 form. Okay, you are opening this claim form every day or not, if you are going as a experience. Okay, so this is about the CMS 1500 form. It is having 33 boxes. You can print and stick it on your wall if you are having that much time and dedication towards study on the material. Okay, definitely you should stick actually. Okay, because we have to remember some important boxes. Okay, and this is very easiest question in every interview. You can face in every interview. Randomly they will ask you some boxes. Okay, so this is about the CMS 1500 form. In say 1 second, in today's session, our portion is only for the CMS 1500 according to the syllabus, and tomorrow we'll start terminologies, which is very important. Okay, this will create your base. Every day many things are there in everyday daily work, we will use that. Okay, so at least you should know about every document, every terminologies, and from terminologies also 3 to 4 questions will be there in every interview. Okay, so next 2 3 days, at least 2 days minimum, we'll have session on terminology. Okay, so I'll stop here and we'll continue tomorrow. Okay, so guys, you have any question?